Now the recording is started. Right. The recording is started now. So, as we were discussing about the Unit 4, uh, which was working in health and social care, yesterday we discussed the learning outcome 3, and today we are going to discuss the learning outcome 4. So, I'm your tutor. I'm Syed Madharuddin Taj, and in today's session, we are going to explore the concept of working relationships in health and social care. That is the learning outcome 4. And understanding these relationships are crucial because they directly influence the quality of care provided to individuals. We will discuss the types of working relationships you may encounter and the importance of effective collaboration as well. And again, in the meanwhile, if you have any question related to the topic, you can ask and I'll try my best to answer. So in this one, we have, when we talk about the working relationships in health and social care, we have health and social care workers. So this group includes a wide range of professionals such as nurses, doctors, care assistants, and social workers as well. And each role is essential in ensuring that individuals receive the care they need. For example, a doctor diagnosing a patient or a service user condition and a nurse providing daily care both play vital parts in the patient overall well-being. Then we have uh, carers, family, and friends. So family members and friends provide invaluable support to individuals in care, including them in the care process, help ensure that the individual preferences and the needs are respected. For example, involving a family member in the care planning for a loved one with dementia can provide insights that professionals may not be aware of. Then we have also colleagues uh, in relationship in health and social care. So working well with our colleague is essential for providing consistent care. Good relationships with colleague involve clear communication and collaboration. For example, a care assistant may need to work closely with a social worker to ensure a patient's care plan is followed correctly. Then we also have uh, some uh, key agencies and professionals, like we have external professionals and agencies play a role in individual care. So building a strong working relationship with these entities ensures that care is comprehensive. As an example, coordinating with an occupational therapist and a housing agency can ensure that a service user home environment is safe and supportive after discharge from the hospital. Then we have, um, we can say, if we work with the workers, carer, family, friends, colleagues, or key agencies and professionals. So, health and social care involve a wide range of individual and organization working together. These include not only the direct care providers, such as nurses and social workers, but also family members, friends, and various external agencies. These agencies may provide support with healthcare, social care, personal budgets, care advice, housing, advocacy, education benefits, education and benefits, state benefits, we can say also, and occupational therapy as well. So we can imagine a scenario where a person with disabilities is planning to move into supported living. The care team might include health worker, social worker, the person's family, and agencies that offer housing and educational support. So, effective collaboration between these groups ensure that the transition is smooth and meets the person need. And what benefits we get and what do we do is like to facilitate social inclusion, person-centered care, active partnership, empowerment. Um, we also do participation. We also work for reducing inequalities of opportunity. We also uh, like uh, respect, and we also respect for the choices of the individual. So we can say that social inclusion and person-centered care are key principles in health and social care. So these principles focus on treating individuals with dignity and respect, involving them as active partners in their care, and empowering them to make choices that reflect their preferences and needs. Um, as an example, for a person with, uh, we can say, mental health issues, uh, facilitating their involvement in community activities like a local gardening group, it promotes social inclusion and enhance their well-being. It's about providing opportunities that respect their choices and reduce inequalities they might face. Then we have best outcome for individuals. So, working relationship in health and social care should aim for the best outcome for individuals. This involves ensuring that services are delivered uh, properly and we are using the resources effectively. The expertise and the knowledge of specialists should be utilized and advice and guidance shared across the team to ensure comprehensive care. As an example, in a situation where multiple agencies are involved in the care of a child with complex needs, so coordination between these agencies are vital, and by sharing information and expertise, they can create a unified care plan that avoids duplication of services and ensure all aspects of the child needs are met efficiently. We have um, consistency and continuity of service and sharing of roles. So we can say that consistency and continuity are crucial in providing reliable care. This means that roles and tasks should be clearly defined and shared among team members. Knowledge and skills should be identified and utilized effectively, and mentoring should be available to support ongoing professional development. uh, Appropriate information sharing also be there, and why it should be there, so it ensures everyone is on the same page regarding an individual care. uh, in example, we can say that in a residential care setting, having clear protocols for handling over information between shifts, it ensures that all caregivers are aware of any changes in a resident condition, maintaining consistency in care. Then we have uh, leaders as well. So there is a big role of leader. So we can say leadership plays a vital role in health and social care setting. Leaders are responsible for modeling good practice, being knowledgeable about current issues, conducting risk assessment, and identifying necessary action. So they also ensure that the staff receive appropriate training, opportunities for shadowing, and access to resources needed to provide high quality care. Then we have for example, we can say a manager in a care home might lead by example by regularly participating in care activities, staying updated on best practices, and ensuring that all staff members have access to ongoing training. So, this approach fosters a culture of continuous improvement and excellence in care. Um, so we can say in health and social care setting, understanding the different types of working relationship is crucial for providing effective and holistic care. So these relationships can be categorized into like four main types, each playing a significant role in the care process. So the first one, we can say that we have individuals and their friends and family. So the relationship between individual receiving care and their friends and family is fundamental. These relationships provide emotional support, uh, advocacy, and insight into the preferences and need of the individual. For example, family members know the individual routine, uh, preferences, and history, which can greatly help in personalizing care. Um, for example, in a care home, involving the family in decisions about the resident daily routine help ensure that the care provided aligns with the resident preferences and history, making them feel more at home and respected. Then the second one is, for example, we can say our colleagues and managers. So colleagues and manager are our immediate professional network within the workplace. So these relationships are vital for ensuring a consistent and coordinated approach to care. Clear communication and collaboration among colleagues help prevent errors and ensure that care is delivered effectively. Um, for example, we can say a nurse working in a hospital ward must communicate clearly with their manager and colleagues during shift handovers to ensure that patient care is continuous and that any changes in a patient condition are noted and acted upon promptly. Then we can say uh, we have people from other workplaces that include advocate as well. So this category includes professionals from other organizations such as occupational therapists, social workers, and advocates. So working with these external professionals help provide a more comprehensive approach to care by bringing in a specialized knowledge and resources. For example, we can say when a patient with mobility issue is being discharged from the hospital staff might work with an occupational therapist from another organization to arrange for necessary home modifications. Then we have uh, volunteers and community group. So volunteers and community group play a crucial role in providing additional support and services that may not be covered by formal care setting. So these relationships can help integrate individuals into the community and provide extra resources and support. So, as an example, we can say a community group might organize social activities for elderly residents in a care home, helping to combat loneliness and promote social interaction. So, here we have the indicative content, uh, which we will cover uh, in the learning outcome. So, as we have discussed the role of health and social care worker, carer, family friend, colleagues, key agencies, and professional, um, then we have to facilitate social inclusion, person-centered care. So I gave you the example of all of them, and then we have best outcome for the individual. We need to look for the consistency, and we have discussed about the role of leader as well. Then we have the key terminologies. So uh, we have discussed about the uh, what are different working relationships in health and social care settings. So we discuss about the individual and their family, colleagues and manager, and we have people from other workplaces, including the advocates, and we have volunteers and community group as well. So then we have discussed about what are partnership in health and social care. So if we talk about partnership in health and social care, so it involves collaboration between two or more people or organization to improve service delivery. So these partnerships are essential for maximizing resources, sharing expertise, and enhancing the quality of care provided to the uh, service users. Then we have association between uh, two or more people and or with organization. So a partnership in health and social care typically involves a formal or informal agreement between individuals or organization to work together towards a common goal. This could be a partnership between healthcare providers and social services to address the comprehensive need of a service user. For example, we can say a partnership between a hospital and a mental health charity might be established to provide better support for patients with mental health condition. So ensuring that they receive both medical treatment and psychological support as well. Then we have okay, then we have to discuss about the pooling expertise. So by pooling resources, expertise, and capabilities, partnership can offer a broader range of services and improve the overall quality of care. So this collaboration allows organization to provide services that they might not be able to offer individually. As an example, a partnership between a local council, healthcare provider, and housing agencies might result in a comprehensive services that address the health, housing, and social need of homeless individuals, leading to better outcomes than any one organization could achieve alone. Then we have goal of enhancing efficiency and quality of service provision. So, the primary goal of partnership in health and social care is to enhance both the efficiency and quality of service provision. By working together, organization can streamline processes, reduce duplication of errors, and provide more coordinated and effective care. So, in an integrated care system, partnership between primary care, hospitals, and social services can lead to a more seamless experience for patient, reducing waiting time and improving overall patient satisfaction. Then, what we have next? Right. The next one we have is teamwork. So, when we talk about um, the concept of teamwork in health and social care, so which is essential for achieving larger goals and ensuring effective and coordinated care. So, uh, team is formed to achieve a larger or bigger goal. We can say that teams in health and social care are formed with the primary purpose of achieving significant and often complex goals that cannot be accomplished by individual working alone. So this includes providing comprehensive care that meets the individual or the diverse need of patient or service user. Um, if we talk about an example, so we can consider a multidisciplinary team in a hospital that include doctor, nurses, social worker, and physiotherapist. So this team work together to create and implement a care plan for a patient recovering from surgery. So ensuring that all aspects of the patient recovery, including medical, physical, and emotional needs, are addressed. Then we have the process of working collaboratively with a group of people in order to achieve a goal. So, teamwork involves collaboration where each team member contributes their skills and expertise to achieve a common goal. So, effective collaboration require open communication, mutual respect, and a shared commitment to the team objectives. Uh, For example, in a community health setting, a team might work together to implement a public health campaign aimed at reducing the incidence of diabetes. So each team member bring their unique expertise, where in health education, nursing, or community outreach to ensure the campaign's success. Uh, then we have teamwork models. So understanding teamwork model can help us build and manage team more effectively. So two key models often referred in health and social care are Dr. Bruce Tuckman and team building model and Dr. Bablin's team role. So, when we talk about Dr. Tuckman propose a model that describe the stages of team development. It involves forming, storming, norming, performing, and adjourning. So, um, when we talk about it, so each stage represent a different phase in a team evaluation from initial formation to the completion of its goal. So, as an example, in the storming stage, a newly formed team might face challenges and conflict as members begin to express their individual opinion. So, however, by progressing through the norming and performing stages, the team learns to work more cohesively, leading to more effective collaboration. Then, if we talk about uh, Dr. Belbin's model. So it involves the team role. So Dr. Belbin identified 9 roles that people typically take on in teams and grouped into 3 categories, and which are action oriented, people oriented, and thought oriented roles. So these roles help ensure that all aspects of a task are covered from planning and executing to monitoring and innovating. Uh, for example, in a healthcare team, a coordinator um, might ensure that the team activities are aligned with the overall goal. So um, then, if we talk about an action-oriented role, so uh, action-oriented role drives the team forward, and a uh, thought-oriented role offer a creative solution to complex problem. So overall, understanding these models help us not only from effective team, but also recognize and value the different role each team member play, and it ultimately lead us to better outcome for those in our care. And here we need to discuss about discuss. describe different working relationship in health and social care setting. Right. So when we talk about working relationship in care setting, health and social care setting. So, in if we talk about care setting, so working relationship can involve various people, including the individual you support, their families, our colleagues, and other professionals. So these relationships are bound by professional standards and guidelines, ensuring that they remain focused on providing the best care. As an example, your relationship with a resident in a care home is a professional one. You are there to provide care and support according to their needs as outlined in their care plan while maintaining appropriate boundaries. Then we have working relationships are professional relationship and should not be confused with personal relationship. If we discuss about it, so we can say that it's crucial to understand that working relationships differ from personal relationships. Working relationships are governed by professional standards and should be kept within the boundaries of your role. And personal relationship, on the other hand, are more informal and involve personal connection that go beyond our professional duty. As an example, while you might care deeply about the well-being of the individual you support. So your interaction with the team should always be guided by professional standards, such as respecting their privacy and confidentiality. Unlike personal relationship where emotion and personal opinion might play a larger role, working relationship must remain objective and focus on the individual care needs. So the third point we need to discuss is relationship with individual you support and their family. So one of the key working relationship in care setting is with the individual you support and their family. So because you have a regular contact with these individual, so it's important to build a professional relationship based on trust, respect, and effective communication. So this relationship should be focused on supporting them in line with their care plan, ensuring that their needs and preferences are met. For example, we can say if you are caring for an elderly resident who has specific dietary needs. So your relationship with them and their family is crucial. The family can provide insight into the resident food preferences, which can help you tailor their meals to meet both their nutritional needs and the personal lives, enhancing the quality of their life. And we have to discuss about the relationship with the uh, colleagues. So another essential working relationship is with your colleagues and manager. So this relationship is built on teamwork, communication, and mutual support. So sharing ideas, making decision together, and helping one another in your role are the part of this professional relationship. Maintaining professionalism in these interactions is critical, as is following your employer agreed ways of working. So, for example, in a care setting, you might work closely with other care assistants, nurses, and managers to create a care plan for a new resident. So each team member bring their own expertise to the table, and by working together, you ensure that the care plan is comprehensive and tailored to the resident needs. So if you encounter any issues such as noticing a decline in the resident health, so it is your duty, your responsibility to report these concerns to your manager immediately. And in healthcare, and social care, you will maintain working relationship not only with the individual you support and your colleagues, but also with a variety of uh, outside agencies and professionals. So these relationships are essential for achieving the best outcome for those in our care. So now here we need to discuss about uh, the working relationship with outside agencies and professionals. So again, these relationships involve collaboration with external professionals who contribute their expertise to the care and support of individuals. So these partnerships are critical for providing comprehensive and coordinated care. As an example, if you are working with an individual who has complex health needs, you might regularly interact with their social worker, nurse, and general practitioner to ensure that all aspects of their care are covered and that everyone involved is on the same page. Then we need to discuss about the examples of agencies and professionals you may work with. So first one we have is social worker. So social workers play a crucial role in assessing individual needs, providing support, and ensuring access to necessary services. They often work closely with health and care staff to develop and implement care plans. So, for example, a social worker might be involved in coordinating the discharge of a patient from the hospital to a care home, ensuring that the transition is smooth and that the individual needs are met in their new environment. Then we have nurses. So nurses provide medical care and support, and often being the primary point of contact for patients in various settings. So they also administer the treatment, monitor health condition, and work with other professionals to deliver care. So, as an example, in a care home, uh, you might work alongside nurses to monitor resident health, administer medication, and respond to any medical concerns that arise. Then we have GPs, general practitioners. So they are often the first point of contact in healthcare system, providing ongoing care and referring patient to specialists when necessary. So, for example, when an individual in a care setting experiences new or worsening symptoms, you might work with their GP to arrange a consultation, update care plan, or adjust medication. Then we have psychologists. So psychologists assess and support individuals with mental health needs, providing therapy, counseling, and behavioral intervention as well. So then we have advocates. So advocates support individuals in making decision about their care and ensuring their voices are heard, particularly when they are unable to speak for themselves. So, as an example, if an individual has difficulty understanding or communicating their need, an advocate might help ensure that their rights and preferences are respected in care planning meetings. Then we have appointees. So, appointees are responsible for managing the benefits and finances of individuals who are unable to do so themselves. So ensuring their financial well-being is maintained. So for example, we can say an appointee might work with care staff to ensure that an individual financial needs such as paying for care services are met appropriately. Then we have dietitians. So dietitians provide nutritional advice and support helping to manage specific dietary needs or conditions. Um, in care home, dietitian might create a specialized meal plan for residents with diabetes to help manage their blood sugar levels. Then we have occupational therapists. So occupational therapists support individuals in achieving independence in their daily activities, often through rehabilitation and the provision of aid and adaptation. So for example, if a resident in a care home has difficulty with mobility, so an occupational therapist might assess their needs and recommend some adaptation to their living space, and such as installing grab bars or providing a walker. Then we have a professional relationship with other organizations. Mhm. Other organization, yes. So uh, if we talk about it, so in addition to working with external professional, we might also maintain professional relationship with other organizations that collaborate uh, with your company. So these could include regulatory bodies, contractors, and service providers. So for example, you might interact with the Care Quality Commission (CQC) during inspection to ensure that your care setting meets all regulatory standards, or alternatively, you could work with outside contractors such as a software supplier who provides the tool you use for record keeping or care planning. Uh, Person, right? Then we can also discuss about the importance of professional relationship. So if we talk about the professional relationship in health and social care, we can say that is foundational to delivering effective care. So we have trust and respect, we have effective communication. uh, Now, right. So now we need to discuss about the role of an advocate in health and social care. So we will discuss the crucial role of advocate in health and social care setting. And advocate play a vital role in ensuring that the voices of vulnerable or disadvantaged individuals are heard, their rights are respected, and they receive fair treatment. So what they do is offering independent support to those who feel they are not being heard. So advocates provide independent support to individuals who might feel that their concerns or needs are not being addressed. So this could be due to various reasons such as communication barriers, cognitive impairments, or social disadvantages. So the advocate's role is to ensure that these individuals are taken seriously and their concerns are given proper consideration. So, for example, consider an elderly patient in a care home who feels that their complaints about their living condition are being ignored. So, an advocate would step in to represent this patient concern to the care home management and ensuring that the issue is addressed appropriately. Then, we have to ensure that the rights are respected. So advocate help protect and uphold the rights of individuals in health and social care setting. This include ensuring that individuals are treated with dignity and respect and that their legal rights are not violated. So advocate also assist individual in assessing and understanding the information and services they need to make informed decisions. Mm, For example, if a person with learning disability is being denied the right to participate in decision about their care, an advocate would work to ensure that their rights to be involved is respected and that they are provided with the necessary support to understand the information being presented to them. Then, uh, equal, right. Then we have supporting vulnerable or disadvantaged individual. So we can say advocacy in health and social care is particularly important for individuals who are vulnerable or disadvantaged and might struggle to ensure that their best interests are protected. So this can include people with disabilities, mental health issues, or those who face discrimination. So, as an example, a person with severe mental health challenges might struggle to express their needs or make decisions about their care. An advocate would support this person by helping them articulate their preferences and ensuring that these are considered in care planning. Then we have some objectives of advocacy in health and social care. So the client voice, views, and experiences are heard and respected. So one of the main goal of advocacy is to make sure that the client voice is heard. Advocate ensure that individual can express their views and experiences, and that these are taken seriously by healthcare providers. As an example, during a case review meeting, an advocate might ensure that a service user desire to maintain in their own home rather than move to a care facility is communicated and considered by the care team. Then we have to discuss about equal and fair treatment. So advocate work to ensure that individuals receive equal and fair treatment regardless of their abilities. So this include uh, combating albism, which is discrimination against people with disabilities. Um, for example, if a person with a disability is not being given the same opportunities for rehabilitation as others, an advocate would intervene to ensure that they receive fair access to services. And then we need to discuss about making service user aware of their rights. So advocacy also involve educating individual about their rights under current legislation so that they can make informed decision. This empowerment allows them to take control of their care and ensure their rights are respected. As an example, an advocate might help a patient understand their rights to refuse certain medical treatment, ensuring that the patient can make an informed decision based on full knowledge of their options available to them. Right. Now we need to discuss about, mm, according to the law. So if we discuss about the CARE Act 2014, so the CARE Act 2014 states that patients should be able to take part as fully as possible in any discussion in which discussions are or the decisions are being made about their social care. So the CARE Act ensured that individuals are involved as much as possible in decision regarding their care. So this means that they should be included in decision and have the opportunity to express their views and be provided with information in a way that they can understand. So, for example, if a care plan is being developed for an elderly person, the care team should actively involve them in the discussion, explaining the options and allowing them to voice their preferences. Then, then we have to discuss about have their views, wishes, feeling, and belief uh, considered and respected. So, the CARE Act emphasizes the importance of respecting the individual personal views, wishes, and belief in the decision-making process. This means that the care provider must take into account that what the individual want, not just what they think is best for them. So, for example, if a person religious belief influence their dietary preferences, so these should be respected and accommodated within their care plan, ensuring that the care provided aligns with their values. Then we have all their relevant circumstances taken into consideration. So when making decision about care, it's essential to consider all the relevant circumstances surrounding the individual, uh, including their physical, mental, and emotional well-being, as well as their social and cultural background. So, for example, for someone who has recently lost a spouse, the care team should consider their emotional state and possibly provide additional support to help them cope with their grief. Then, okay, then we need to uh, discuss about uh, an advocate is required when a patient has difficulty understanding. So if we talk about it, so advocacy become crucial when an individual has difficulty comprehending or processing important information, or when they struggle to communicate their views. So in these cases, an advocate can step in to ensure that the person's rights are upheld and that they are supported in expressing their needs and preferences. For example, a person with dementia may find it challenging to understand the implication of different care options. So, an advocate would work with them to ensure that their views are still represented and considered in the decision making process. Then, we need to discuss about the local authorities. So, if an individual is comfortable and agrees to have a friend, family member, or unpaid carer act uh, on their behalf, the local authority is not obligated to provide a professional advocate. So, this appropriate person can offer the support needed in making decision. So, as an example, we can say if an elderly person prefers their daughter to help them make decision about their care and they consent to this agreement, the daughter can act as the appropriate person, and it negated the need for a professional advocate. And we need to discuss about factors that disqualify a person from standing as a patient appropriate person. Uh, right. So if we talk about that, then if we say the patient does not consent to their standing as advocate, so consent is crucial. If the individual does not agree to someone acting as their advocate, so that person cannot take on this role. Uh, For example, if a patient state that they do not want a particular relative involved in their care decision, so that relative cannot act as their advocate. So then we need to discuss about um, paid or professional carer. Mhm. So professional carer or paid workers cannot serve as an individual advocate to avoid conflict of interest, um, when they have the conflicts of interest and ensure that the advocacy remain impartial. So, for example, a care worker who is employed by a nursing home cannot also act as an advocate for one of the residents in that care home. Then we have local authority. So the local authority has the discretion to disqualify someone from acting as an advocate if they believe that the person involvement is not in the best interest of the individual needing care. As an example, if there are concerns that a family member might not act in the individual best interest, so perhaps due to conflicting interests, the local authority can decide that this person should not be the advocate. Then need to discuss about the capacity. So if the individual lack the capacity to choose an appropriate person to act on their behalf, a professionally appointed advocate is necessary to ensure that their rights and interests are protected. So, for example, uh, uh, for a patient who is unconscious or has severe cognitive impairments, a professional advocate might be appointed to ensure that the individual best interests are represented in care decisions. Now, here we need to discuss about benefits of partnership working in health and social care. Right. So, partnership uh, partnership working in health and social care is crucial for achieving positive outcome for individual receiving care. It involves collaboration among various team members and professionals, which not only benefit the service user but also enhances the skills and knowledge of care team. So when we talk about it, then we have to discuss about work together towards shared goals. So partnership working allows different professional and team members to unite around common goals such as improving patient care or enhancing service delivery. So this collaborative approach ensures that everyone is working uh, and focusing on the same outcome. And we have share ideas and experiences. So when professionals work together, they share their diverse ideas, experiences, and perspectives, which can lead to better problem solving and innovation. So, this exchange of knowledge help everyone involved to grow and develop their skills. For example, a nurse might share their experiences with managing a patient pain using a known pharmacological method, which could be new to other team member. So this shared knowledge can then be applied in similar cases, benefiting more patients. Mhm. Then we have discussed about assess specialist skills and knowledge. So partnership working allows team to tap into specialist skills and knowledge of different professionals. So this ensures that the care provided is well-rounded and that all aspects of an individual needs are met. Then we have to discuss about ensure service user receives the best possible care. So the ultimate goal of partnership working is to provide the best possible care to service user. By collaborating and sharing expertise, the care team can offer more comprehensive and effective care tailored to the individual's specific needs. Then we have to discuss about comply with agreed ways of working and professional standards. So effective partnership working also involve adhering to agreed protocols and professional standards. This ensures that care is consistent, safe, and in line with legal and ethical guidelines. So For example, all members of a healthcare team might follow a standardized protocol for infection control and ensuring that best practices are maintained across the board and that the risk of infection is minimized for all service users or all patients. Then we need to discuss about the importance of person-centered care, uh, partnership with the individual and other because right. So there is individual lives and right. So we need to discuss about the person-centered care, and so we can say that person-centered care uh, is fundamental approach in supporting individuals with any issues. Then, so this approach ensures that the care provided is tailored to meet the unique need, preferences, and abilities of each individual. So then we need to discuss about uh, it gives the individual choice and control over their life. Right. So individual okay, here we need to discuss about autism. Okay, so individuals with autism should be recognized as expert on their own lives. So this means that they should have as much choice and control as possible over the decision that affect them. By treating them as equal partner in the decision making process, we can respect their autonomy and empower them to live more independently. For example, if an adult with autism prefers to live independently rather than in a group home, their choice should be supported and the necessary resources should be provided to help them succeed in their preferred living arrangement. Then to discuss about the second bullet point, which is related with the uh, person-centered care, require practitioners to focus on the individual unique needs, preferences, and circumstances. So rather than applying a one-size-fits-all approach, this involves listening to the individual and their family, respecting their knowledge and experience, and tailoring care to suit their specific situation. For example, a healthcare professional working with a child with autism might adapt their communication style using some visual tools and that the child responds to best and ensuring that the child feel understood and comfortable. Then we need to discuss about uh, wishes and preferences. So, by focusing on the individual needs, wishes, and preferences, care and support services can bring more effective and meaningful support. And patients or caregivers of individuals with autism often develop um, you can say that often have some deep insight into what works best for their child, and their input should be considered when developing care plan. So for example, if a patient know that their child um, mm, if we say that a parent know that their child with autism is particularly sensitive to loud noises, and care plan should include some strategies to minimize exposure to such environment, perhaps the scheduling appointment during quieter times or providing some noise cancelling headphone. So last bit is we need to discuss about health and care professional. So while the individual and their family are expert on their professional experiences, or the personal experiences, sorry, not the professional, we can say the personal experiences. So health and care professionals bring essential clinical expertise to the table, and this collaboration ensures that the individual receive well-rounded support that address both their medical and personal needs. For example, a clinician might provide advice on managing anxiety in an individual with autism, so suggesting evidence-based intervention that can be integrated into the person's daily routine in a way that aligns with their preferences and lifestyle. Mhm. Right. Now we need to discuss about uh, some example. So Uh, partnership working is essential in health and social care, especially in situations where effective communication and collaboration directly impact patient outcome. So, for example, nurse prescribing an anesthetic for a dental procedure. So, if we talk about it, so in some medical situation, communication between professionals is critical for patient safety and care. For example, if a nurse prescribes an anesthetic for a patient undergoing a tooth extraction, the uh, then the primary point of communication is the anesthetist, and the nurse must quickly and effectively communicate details about the patient condition and the prescribed medication to the anesthetist. So, who need this information to monitor the patient response and ensure the safety during the procedure. So, for example, we can say that if we imagine a scenario where a patient has a known allergy to a specific medication, the nurse must inform the uh, anesthetist about this allergy before the anesthesia is administered to avoid a potentially life-threatening reaction. Then, if we discuss about working alongside care assistant and support worker, so in health and social care, delivering planned care involve a team effort. Nurses or care assistant and support worker must collaborate to ensure that the care plan are followed accurately and that the individual needs are met effectively. Mhm. Then we have supporting a junior doctor. So, for example, if we discuss about it, then during surgical procedures, an experienced healthcare professional, such as a senior nurse or surgeon, support junior doctor. So, this partnership is crucial for ensuring that the procedure goes smoothly and that any issues are addressed promptly. So, for example, in a surgical setting, a senior nurse might assist a junior doctor by preparing instrument, monitoring the patient vital, and providing guidance on protocol. So, this support helps the junior doctor focus on the surgery while ensuring that the patient receives safe and effective care. Then we have to discuss about the children, young people and vulnerable adults. So safeguarding involve protecting children, young people and vulnerable adults from harm, abuse or neglect. So this require a multidisciplinary approach where healthcare professionals collaborate with police, social worker, teacher and other agencies to assess the risk and take appropriate action. Uh, okay, so here we need to discuss about communication. Okay. So, poor communication between healthcare staff can lead to significant risk for patients when important information such as medication history, allergies, diagnosis, or other critical detail is not shared accurately or promptly. It can result in uh, inadequate care and even harm to the patient. So, ensuring that communication channels are clear and reliable is essential for maintaining patient safety and delivering high quality care. So, as an example, uh, if in a scenario where a patient is allergic to penicillin and is not communicated to the attending nurse, if the nurse administers a penicillin-based antibiotic without knowing the patient allergy, the patient could suffer a severe allergic reaction, putting their lives at risk. Then we need to discuss about effective interpersonal skill. So, to work effectively as part of a healthcare team, you need a strong interpersonal skill. So, this includes the ability to communicate clearly, listen actively, and engage in meaningful dialogue with colleagues. So, following agreed protocols and procedure, ensure that everyone is on the same page and that care is delivered properly. Mm, and try. And we need to discuss about mm, collaboration. So collaboration is key to effective partnership working. So this means working together with each member of the team, respecting their input and being willing to compromise or like when it's necessary. So compromise is often needed to reach decisions that are beneficial to all parties involved and including the patient. So for example, in a multidisciplinary team meeting, the doctor, nurses, and social worker might have different perspective on the best course of action for a patient care. By listening to each other viewpoints and finding a middle ground, they can develop a care plan that addresses the patient medical need while also considering their social circumstances and personal preferences as well. Uh, okay. So now here we need to discuss about the benefits of partnership working in health and social care. So working in partnership with other is crucial in health and social care, not only for the benefit of the patient, but also for the protection and growth of the professional involved. So we, if we talk about protection from litigation. So one of the critical benefits of working in partnership is that it provides a safety net that can protect you from legal issues. So when you collaborate effectively with your colleagues, you reduce the chances of error, which in turn reduces the risk of litigation. And in the case of emergencies or unexpected issues, the collective knowledge and quick communication among team members can potentially save a life. And as an example, we can say, imagine a scenario where a patient experiences an allergic reaction during a procedure. So if the healthcare team communicates quickly and effectively, administering the correct treatment properly, they can prevent the situation from escalating, potentially saving the service user life and avoiding legal complication. Then if we discuss about greater knowledge and expertise, so when professionals collaborate, they bring together a wealth of knowledge and expertise. By taking input from other team members, healthcare professionals can ensure that they are considering all aspects of patient care, leading to better outcome. So this collective approach helps maintain high standards of care and ensure that patient receive the best possible treatment. Then we discuss about now social progression through mutual respect and trust. So, effective partnership working is built on mutual respect and trust. When colleagues trust each other, they work better together, which benefit both the team and the patient. So, a strong professional relationship lead to a more positive work environment, and it increase job satisfaction and better patient care. Mhm. Then we need to discuss about communication and support. So no one can do everything on their own in healthcare. So it's essential to work in partnership with others, relying on each other's strength and providing mutual support. So effective communication is the key to this process, and it requires trust, good rapport, and a strong interpersonal skill. So if you struggle to build these relationships, it can negatively impact your work and the care provided. Now here we need to discuss about the role and benefits of effective teamwork. Okay. So we can say that effective teamwork in health and social care is vital for improving outcomes, enhancing professional satisfaction, and providing essential peer support. So here the first point we need to discuss about the clinical outcome. So, when healthcare professionals work effectively as a team, it not only leads to better patient outcome, but also increases job satisfaction among the professional involved. So, working in a supportive team environment help reduce stress, prevent burnout, and fosters a sense of care and shared purpose. Then as an example, in a hospital setting, when a team of doctors, nurses, and other healthcare workers collaborate effectively, they can manage patient care more effectively, leading to quicker recoveries and fewer complications. So this not only benefit patient but also provide a sense of accomplishment and satisfaction for the team member. Then we need to discuss about high quality care involve some interaction with multiple healthcare professionals across different clinical setting, and it's related with the coordination and collaboration. So recognizing the need for careful coordination and collaboration among the professional has led to initiative aim at improving teamwork. So effective teamwork ensures that the care is proper, and that all professionals involved are working towards the same goal. As an example, a patient undergoing surgery might interact with a surgeon, nurse, and physical therapist. So effective teamwork ensures that each of these professionals are aware of the patient need and that their care is coordinated from pre-surgery preparation to post-operative recovery. Then we have multidisciplinary teams. So, multidisciplinary teams are designed to organize and coordinate health and care services for individuals with complex needs. So, these teams bring together professionalism from various fields to jointly assess, plan, and manage care. So, multidisciplinary team ensure that all aspects of an individual care are addressed and properly followed. As an example, for a patient with chronic health conditions such as diabetes and heart disease, a multidisciplinary team might include a general practitioner, a cardiologist, dietitian, and social worker. So this team work together to create a care plan that addresses all of the patient need, helping to manage their condition more effectively. Now, if we talk about the multidisciplinary team in community and primary care, so multidisciplinary teams are often based in the community and network with primary care providers. They work proactively to support individuals in achieving their uh, care goal, focusing on keeping people well and independent. So, by delivering the right care at home or in the community, multidisciplinary team help prevent unnecessary hospital admission and reduce the strain on healthcare facilities. Then, uh, right, so we have discussed about uh, both the hospital, and if we discuss about an example for multidisciplinary team, we can say that for a patient with a uh, chronic condition, regular monitoring and management by an multidisciplinary team in the community can prevent complications that might otherwise lead to hospitalization. So this approach not only improves the patient quality of life, but also reduces healthcare costs by avoiding expensive hospital treatments. So here, mm, right. So as we discuss about the, as I gave you the example of patient with chronic condition. So here, for example, we need to discuss about one of the key goal of multidisciplinary team is to prevent unnecessary hospital admission by providing comprehensive care in the community. So by assessing a range of health, social care, and other services, multidisciplinary team aim to keep people well and independent, ensuring that they receive the right care at the right time in the most appropriate setting. So here we have a YouTube link as well, which you can see. Okay. So here they have given us a case study. So it's with the city and Hackney. So in this case study, we will explore the collaboration between Berkshire Healthcare NHS Foundation Trust and Bracknell Forest Council. So within the context of a community mental health team, so this example highlights the importance of multidisciplinary teamwork and integrated care in mental health services. So they have given us the uh, background. So Berkshire Healthcare NHS Foundation Trust is responsible for providing community and mental health services across East and West Berkshire. And it has six unitary authorities. The East Berkshire region is part of the Frimley Integrated Care Board, which include part of Surrey and Hampshire. Among the unitary authorities in Berkshire is Bracknell Forest Council, which plays a significant role in the provision of these services. So, as an example, the integration of services across different regions and authorities, such as in this case, help streamline care delivery and ensure that all areas are covered regardless of geographic boundaries. So, this integration is crucial in managing the diverse need of the population, particularly in mental health care, where services need to be both accessible and comprehensive. Then we have the multidisciplinary team, and it's specifically mental health multidisciplinary team. So the community mental health team for adult in Bracknell represent a collaborative effort between the teams, and this team is composed of various professionals, including social worker, mental and physical health nurses, psychiatrists, physiologists, uh, and psychotherapists as well. So, by working together within the same building under the joint management, these professionals can offer a more uh, cohesive and comprehensive approach to mental health care. So, for example, a patient suffering from severe anxiety might require both psychological therapy and social support. In this multidisciplinary team, a psychologist and a social worker can collaborate directly, ensuring that the patient receives therapy while also addressing any social factors such as housing or employment that may be contributing to their anxiety. So this joint effort help provide a holistic approach to treatment. Then uh, just thinking, others, okay, so here we need to discuss about the use of technology as well. So one of the standout features of this multidisciplinary team is the use of shared electronic recording system. So all team members, regardless of their specific discipline, use the same system to document patient interaction, treatment plan, and outcome. So this approach ensures that everyone involved in the patient care has access to the same information, fostering better communication and coordination. Then also we need to discuss about the meetings. So the team hold weekly multidisciplinary team meetings and chaired by the joint service manager to discuss the need of individual and coordinated their care. So these meeting allows the team to review complex cases and share insight and ensure that all aspects of the patient care are considered. Although patients do not attend these meetings, they are encouraged to discuss their need with their coordinator beforehand and ensuring that their voices are heard. Then we need to discuss about community hub. So if we discuss about the community hub, so the community hub is a local initiative developed by the community network to facilitate collaboration between voluntary and community sector organization and statutory mental health professional. So this hub plays a critical role in helping individuals in their recovery by providing a bridge between more intensive mental health services and community-based support. And members of community network participate in the multidisciplinary team meeting on a rotational basis, and it allows the multidisciplinary team to make informed decision about whether a patient requires more specialized care from the uh, team or can benefit from the less intensive support offered by the community hub. Then we have zoning. So zoning is a new approach being introduced by the multidisciplinary team to enhance the management of individuals who are at high risk. So this involves holding daily mini multidisciplinary team meetings, specifically focused on these high risk individuals. So the goal of zooming is to improve communication within the team, ensure that those who are most in need receive targeted case management and provide an opportunity for peer support among the professionals involved. So, for example, if a patient is identified as being at high risk or relapse or harm, they would be discussed in the daily zoning meeting. The team might decide to increase the frequency of their check-in, with the patient or to adjust their treatment plan to address emerging concerns. So this proactive approach helps prevent crisis and ensure that care is responsive to the patient current need. Then, yeah, we need to discuss about the improvement. So some of the recent improvement implemented by the Berkshire Healthcare NHS Foundation Trust to enhance the quality of care provided through the community mental health team. These improvement focus on feedback mechanism and the structure of multidisciplinary team and ongoing quality improvement initiative. So they have I want great care uh, feedback system. So they have introduced a new system called I Want Great Care to collect feedback from individual about the care they receive. So this feedback is crucial for improving services and ensuring that the care provided meets the needs and expectation of patient. So patient can access this feedback system via a link provided in their appointment letters or by completing a form when they attend appointment. And they have regular reviews of multidisciplinary team format. Uh, so the format of the multidisciplinary team meeting is regularly reviewed by the service manager and the team leads to ensure they are effective and meet the needs of both the team and patients. Then they have quality improvement program. Uh, so uh, we can say that they also runs a quality improvement program with a monthly meeting dedicated to discussing progress in improving care and achieving set metrics. So these metrics are often determined at the organizational level, but can also include locally set metrics by the multidisciplinary team. So this ongoing evaluation process helps to ensure that the quality of care continues to improve and that the team is meeting its goal. And for example, we can say in a monthly quality improvement meeting, the team might review data on patient outcomes, such as the reduction in hospital readmission or improvement in patient satisfaction scores. So they might also set new goals, such as improving the timelines of follow-up appointment or increasing the use of certain intervention. Then they have uh, peer reflection group uh, facilitated by psychology. So multidisciplinary team members have the opportunity to attend a monthly peer reflection group facilitated by the psychology team. So this group provides a space for open reflection where team members can discuss their experiences, challenges, and successes with peers. This reflective practice is essential for professional growth and help build a supportive team environment. Right. Here we have the merit criteria 4M1 and we have an health and social care. Okay. So here we need to discuss about how team leadership can address challenges faced by team in health and social care. So we have here organizational condition, team leadership, technical competence, and clear roles and purpose. So uh, if we talk about organizational condition, so effective teamwork begin with strong organizational condition, and these include a culture that reinforces teamwork, a supportive environment, and leadership commitment at the executive and division level. So without these team, may struggle to function, and leadership may find it difficult to drive improvement. Then we have team leadership. So for team leadership, we can say that accountability, shared leadership, and coaching are vital aspects of team leadership. Teams in health and social care often face high pressure situation where clear direction and shared responsibility are essential. Then we have technical competence. So team must be technically competent, meaning they are well trained, capable, and adequately staffed. And a lack of technical competence can lead to poor patient outcome and increase stress within the team. And we have clear role and purposes. So having clearly defined role, a clear team direction, and established team norms are essential for smooth operation. So without these, team can experience confusion, overlap in duties, and conflict. Then if we discuss about attitudes, so the attitudes of team members, such as valuing teamwork, assuming positive intent, believing in success, and caring for um, and include others, are foundational to positive team dynamic. Then we have behavior. So behaviors specifically do. So the effective behaviors in team include continuous learning, information exchange, monitoring, and backing up others, and managing conflict. Then we have cognition. So shared mental model, situational awareness, and reflecting on progress are key cognitive aspect of effective teamwork. So these elements help team anticipate needs and adapt to changes and continuously improve. Then we have psychological safety and trust. So psychological safety and trust are crucial for team effectiveness, enabling team members to take risks, speak up, and collaborate without fear of negative consequences. Then we have uh, adaptability and resilience. So team in health and social care need to be adaptable and resilient to handle the dynamic and often stressful nature of their work. And we have team effectiveness. So at the top of the pyramid is the team effectiveness. So which is the, we can say, ultimate goal. So effective team deliver high quality care, achieve positive outcome, and maintain a healthy, productive work environment. Then, okay, here we need to discuss about the role of effective teamwork. Right. So effective teamwork is now globally recognized as a critical component in building more efficient and patient-centered healthcare delivery system. So we have a definition of a team. So uh, a team can be defined as a group of two or more individuals who interact dynamically and independently and adaptively towards a common and valued goal objective. So this team is characterized by assigned specific role or function, and it typically operates within a limited time frame. Then we have importance. So, in today's complex healthcare environment, patients are rarely under the care of just one health professional. Instead, a team of professionals work together to provide comprehensive care. So, effective teamwork is essential for patient safety because it minimizes the risk of adverse events that can occur due to miscommunication or misunderstanding about roles and responsibilities. Mm, Right. So here we need to discuss about the uh, team-based healthcare. Mm, Right. So team-based healthcare is a critical approach in the modern healthcare as well. So it involves multiple health providers working together with patient and their caregivers to deliver high quality care. So we have uh, team-based healthcare. So the team-based healthcare refers to the delivery of healthcare services by at least two healthcare providers who collaborate closely with each other, the patient and the patient caregivers. The degree of involvement by each patient and their caregiver is determined by their preferences, and the overreaching goal of this approach is to achieve shared objectives within and across different care settings, ensure that the care is coordinated and of the highest quality as well. Then we have patient. Right. Then we have importance of shared responsibility with accountability. Mm, communication. So we can say that one of the core benefits of team-based healthcare is the sharing of responsibilities among team members and with clear accountability. So this means that each team member contributes their expertise while also being accountable for specific aspect of patient care. So this structure enhances the efficiency and effectiveness of the care provided. Right. So here we need to discuss about the characteristics. Okay. So characteristics of an effective team or successful healthcare team. So we can say an effective healthcare team is characterized by open communication where team members, including the patient, actively share information, insights, and decision-making responsibilities. So this collaboration optimizes patient care by merging the observation and expertise of different professionals. So, for example, consider a patient with diabetes who is working with a care team that includes a primary care physician uh, and a dietitian and a diabetes educator for the team. And like when they work together, so it would be beneficial for the service user or the patient. Then what we have next is we have to discuss about the coordinating teams. No, the first one is we have the uh, core teams. Okay, so uh, for core teams, we can say that uh, core teams are directly involved in providing care to patients. So these teams typically consist of team leader and direct care provider, such as nurses, doctor, dentist, pharmacist, and assistant. So case manager are also part of core teams. Uh, then we have coordinating teams. So coordinating teams are responsible for the operational management of healthcare services They coordinate the functions and resources necessary for the core teams to operate effectively. Then we have contingency team. So they are formed to handle emergencies or specific events. So these teams are often activated in response to unforeseen situations such as cardiac arrest, disasters, or other critical incident. Uh, then they have ancillary teams services, and these teams provide support services that facilitate patient care. These teams include roles like cleaners, maintenance staff, and other domestic services that ensure a clean and safe environment for patients. So we can say, as an example, the role of these teams become evident when considering the importance of hospital cleanliness. For example, cleaners are essential in preventing hospital-acquired infection by maintaining sterile condition in operating room, patient ward, and other areas. So their work support the core healthcare providers by ensuring that the environment is safe for both patient and staff. Then we have support services and administration. So support services and administration team provide indirect task-specific services within a healthcare facility. So these team include secretaries, administrative staff, and the executive leadership responsible for the overall function of the organization. They have 24-hour accountability for the operation of the healthcare facility. For example, we can say an example of support services is the administrative team that manages patient recording, uh, billing, and appointment. So the executive leadership, on the other hand, make high-level decisions that affect the entire facility, such as implementing new policies or managing the budget. So these teams ensure that the healthcare system run smoothly, allowing the core and coordinating team to focus on patient care. Right. So we have finished the slides. So in conclusion, what we have explored today is we have explored the uh, multifaceted nature and the teamwork. Also, we discuss about the multidisciplinary teams. We have gone through their roles and responsibilities. Also, we we discuss about the uh, crucial role that different team play and importance of effective communication and the need for shared responsibility in delivering high quality care. Uh, we discuss the role of team in healthcare. We discuss effective communication and coordination. We also discuss about the shared responsibility and accountability. We discuss about the impact of team leadership. So uh, we discuss about the multidisciplinary team. Also, we have discussed case studies as well. So we have covered a lot of topics related with the learning outcome 4. And again, I'm sorry, I've taken a lot of time of you all again. So I'm sorry for that. And because, as always, I say that I need to cover everything. So that's why I took extra time. Is there any question from any one of you? No? Okay. So we'll finish today's class then. And I'll see you next week. Till then, all of you, please take care of yourself. Bye.